All right, let's dive into developmental disabilities. If you've got an exam coming up, you know this can be a huge topic. So we've boiled it all down into this guide to focus on the key things you absolutely need to know. Let's get you ready to ace that test.
So this is the big question, right? What are the absolute must-know concepts? We're going to break it all down piece by piece so you can walk into that exam feeling totally confident. First, let's look at our game plan.
Okay, here's how we're going to do this. We'll start with the basics to build a solid foundation. Then we'll get into the specific conditions, the ones you'll for sure see on your test. After that, we'll talk about the principles of care, and we'll wrap up by looking at the bigger picture, the person and their family.
Right then, first things first. Before we get into all the different conditions, we need to be on the same page. So what exactly are developmental disabilities? Well, think of them as a group of conditions that show up early in a person's life, during their development. They can affect a person physically or impact their ability to learn, use language, or their behavior. And, this is key, they're usually lifelong. Getting this definition down is the foundation for everything else we're going to cover.
Okay, with that foundation in place, let's get to the heart of it. This section covers the specific conditions you're pretty much guaranteed to be asked about. We'll look at what makes each one unique. First up, intellectual disability. Now here is the number one thing to remember. It is not just about IQ. For a diagnosis, there have to be significant limitations in two areas: intellectual functioning, things like reasoning and problem solving, and adaptive behavior. Adaptive behavior is just a term for all the skills we use to get through our day, socially and practically.
So what does that look like in real life? Well, it can affect how quickly someone learns or their ability to live on their own. But the most important takeaway here is that it's a huge spectrum. The support someone might need can range all the way from mild to profound. It's definitely not a one-size-fits-all situation.
Next, we have autism spectrum disorder, or ASD. And if there is one word you need to burn into your memory for this, it's spectrum. Why? Because it's not a single thing. It's a wide range of conditions, and that's why ASD can look so incredibly different from one person to the next.
So if it's a spectrum, what's the common thread? Well, there are generally three core areas to look for. First, challenges with social communication. Second, restricted or repetitive behaviors or interests. And third, and this one is often overlooked, sensory sensitivities. Things like light, sound, or touch can be overwhelming. This is a really critical part of the experience.
Now let's talk about Down syndrome. This is a classic exam topic, so listen up. It's a genetic condition, and the cause is incredibly specific. It's the presence of a full or partial extra copy of chromosome 21. That's a detail you'll want to remember.
People with Down syndrome often share some common characteristics. This can include some level of intellectual disability, certain facial features, and developmental delays. It's also really important to know that there can be other health issues involved, like heart defects, for example. Okay, moving on to cerebral palsy, or CP. The key word to associate with CP is motor. It affects movement, balance, and posture. And here's an absolutely critical point, and a common trick question on exams. CP is not progressive. The underlying brain injury doesn't get worse over time. So the effects of CP are mainly physical, right? They can range from a little bit of clumsiness all the way to severe physical impairment. But here is the most important thing you can learn from this slide. Having CP does not automatically mean someone has an intellectual disability. They're two separate things, even though they can sometimes occur together.
This table spells it out perfectly. Look, cerebral palsy's primary impact is on motor skills. Intellectual disability's primary impact is on intellectual functioning and adaptive behavior. They can co-occur, but they are not the same thing. Nailing this distinction is huge.
Next up, fetal alcohol spectrum disorders, or FASD. The cause is right there in the name. It's caused by exposure to alcohol during pregnancy. And here's a really important and frankly sobering fact. FASD is the leading known preventable developmental disability. That's a key phrase to remember.
The effects of FASD are lifelong, and they can be really wide-ranging. We're talking about possible physical defects, sure, but also huge challenges with things like learning, memory, attention, and impulse control. And just like autism, FASD is also a spectrum. It affects every single person differently. All right, our next condition is spina bifida. The definition is pretty straightforward. It's a birth defect that happens when a baby's spinal cord doesn't develop or close properly while in the womb. And because this is all about the spinal cord, the effects are, as you'd expect, mainly physical. This often means physical disabilities that affect someone's ability to move around, and it can also include problems with bowel and bladder control. Okay, phew, we've just covered a ton of information on the what. But that's only half the battle. Now we need to talk about the how. How do you take all this knowledge and apply it in a way that's actually helpful and respectful? That's where the principles of care come in.
This right here is your playbook. It's all about something called person-centered care, which really just means seeing the person first, not their diagnosis. It's about encouraging independence, being consistent, communicating clearly, and, this is a big one, always focusing on a person's abilities, on what they can do. This isn't just a checklist, it's a whole philosophy.
And for our last section, let's just zoom out for a minute and look at the bigger picture. Because a developmental disability doesn't exist in a textbook or a vacuum. It happens to a real person, with a real family, in a real community. And you can't be effective if you don't understand that human side of things.
Think about it. On one side, you have the individual. They're navigating daily challenges, sure, but they also have the exact same fundamental human needs we all do: love, a sense of belonging, purpose. Then, on the other side, you have the family. They are so often the primary caregivers, and that job can be incredibly demanding, emotionally, physically, and financially.
But, and this is a really important but, the story is not just about the challenges. It's also filled with so much joy, love, and incredible resilience. Families form these powerful, unbreakable bonds, and they learn to celebrate every single milestone, no matter how small it might seem to others. And that brings us to a final crucial takeaway. Support for the whole family isn't just a nice little extra, it is an absolute necessity. Things like respite care, which gives caregivers a much-needed break, are essential. You have to care for the caregivers so they can keep caring for the people they love. So as we wrap this up, I want to leave you with this one question. You have the facts now, you know the principles. The real test is, how are you going to put it all together to always see the person first? That's what really matters. Good luck on your exam. You're going to do great.